Hello, my name is Andrea. In today's lesson, we're going to learn about the roles and duties of nurses. This lesson is divided into 4 parts. In part 1, we'll learn about nursing grades. In part 2, we'll see some different types of support workers. In part 3, we'll learn about nurses' specializations. And in part 4, we're going to see the role nurses have in a medical center. Let's get started. First, let's see part 1, nursing grades. Just like doctors have different roles according to how far they are in their studies or medical practice, nurses have different grades. Here is a brief classification. Nurses working in a hospital have the following grades. Student nurse, a nurse who is still in training. Staff nurse, a nurse who has completed the training course. Charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department. Nurse manager, a nurse who is in charge of several wards. A female nurse may sometimes be called matron. Let's move on to the next part, which is support workers. In the medical field, it's important to have many helping hands. There are the roles of clinical support workers. They are not as qualified in medical training as a doctor or nurse, but they are very important to the functioning of the hospital. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary, who is usually unqualified, both assist nursing staff. There may also be ward clerks, whose duties include making sure patients' notes and information are up to date and answering the telephone. Now, we'll see part 3, which is specialization. Like doctors, nurses can specialize in the following areas. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. Finally, let's go into detail about what exactly a nurse's job is. Finally, we'll review part 4, the nurse's role. A nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressing, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Example: perform, carry out. An examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed by a nurse. The procedure was carried out by a nurse. That's all for today's lesson. I hope you enjoyed this class. See you in the next lesson.